Hello, and welcome to Understanding SIBO Causes and Treatment as part of CDHF's Trending Now Summit. My name is Lisa Spriet, and I'm a registered dietitian, and I work in the area of digestive health with a lot of clients one-on-one. In terms of my disclosures, I work with the company NutriBroCan. We do both one-on-one and group counseling. And again, I work a lot in the area of digestive health. I've also been an invited speaker on various digestive health topics. Our learning objectives today are to really understand SIBO. I'll tell you what that is in a minute, including the causes and symptoms, and then really to understand how we can best treat it, the various options, including dietary approaches. So we're going to go through what is SIBO, the causes of SIBO, diagnosis and symptoms, treatment options, and then dietary and lifestyle strategies. So what the heck is SIBO? So SIBO stands for small intestinal bacterial overgrowth. So we shorten that to SIBO. It is something that happens in our small intestines. The small intestines are a really, really important place for both digestion and absorption of the nutrients that we consume. For the most part, they are not our largest area of bacteria. Most of our microbes are located in our large intestines, which come after the small intestines. However, we do have a microbiome in our small intestines. And what tends to happen in SIBO is that the microbiome, so some of the bacteria or other parts of the microbiome, migrate from the large intestine back into the small intestine, and they overgrow there, hence the bacterial overgrowth. This is why it's really, really important to have a balanced gut microbiome. The bacteria that are really good for the large intestines are not so great for the small intestines, and we need to make sure that we're having a balance. A little bit more about the small intestine so we can understand better what some of the symptoms of SIBO are, and then also the treatments. So the small intestines are called small because they are small in diameter, not small in length. They're about 20 feet long, and they're really responsible for digesting and absorbing a lot of the food that we consume. So they both have digestive enzymes along their finger-like projections or microvilli, as well as we release a lot of enzymes into the small intestine via the pancreas and bile via the gallbladder, if you have one, otherwise the liver. And then we have all of these transport enzymes along those finger-like projections in our small intestines that are really responsible for absorbing a lot of the nutrients that we consume. There is, as I mentioned, also their own microbiome. And the microbiome of the small intestine is actually really important in both the digestion and production of certain nutrients for our body, which we then absorb. In terms of the symptoms and diagnosis for SIBO, the main symptoms that we see are bloating, gas, as well as diarrhea and abdominal pain. So when we have this large intestinal bacteria going into our small intestine, they overly ferment some of the foods. It also can impair digestion and absorption of some of the nutrients that we have. And as I mentioned, that's one of the main role of the small intestine. Because of this, we then get diarrhea as well as abdominal pain. Quite often in SIBO, we also see alterations in nutrient levels, such as low B12 or high folate. This is because some of the bacteria that are involved in SIBO actually produce folate. And so we see these high blood folate levels. Additionally, because of the damage that's done due to SIBO, we see low B12 levels. So B12 is absorbed typically in the last part of the small intestine. And when we're having these issues in the small intestine, quite often it's not absorbed. In terms of diagnosing it, we have the breath test as well as endoscopy. The gold standard for diagnosing SIBO is, in fact, the endoscopy with small intestinal aspirate. So this would involve a gastroenterologist putting a tube down into your small intestines, sucking up a little bit of the fluid that's in there, culturing that, and seeing the bacteria that's there. And if, in fact, there's high levels of bacteria and there's high levels of bacteria that should be not in the small intestines, but be in the large intestines, then that's typically diagnostic for SIBO. However, this needs to be taken into account with signs and symptoms, bloating, gas, diarrhea, because if we don't have those things and we do have that bacteria, sometimes that's a little bit normal for people. So again, to have an abnormal endoscopy with culturing, but no signs and symptoms doesn't mean that it necessarily needs to be treated. A less invasive way of diagnosing SIBO is through breath testing, where you can see the different levels of different gases that are produced. Now, there's a lot of errors that happen with this. Again, it's less invasive. It's quite often used, but it really needs to be taken into account with the signs and symptoms because there are a lot of ways of interpreting those tests. So what exactly causes SIBO? Well, there's a lot of causes, and usually it's not just one cause. Usually there can be multiple causes that go together to create SIBO. The ones that we're going to review include impaired motility of the small intestine, changes in gut anatomy, conditions like IBS and Crohn's disease, medication, dietary factors, as well as what we say is just unknown. Sometimes people just get it and we're not quite sure why. Okay, so let's start with impaired motility. So what does impaired motility mean? It means poor movement of the small intestines. So typically we eat food, it goes from our esophagus into our stomach, into our small intestine, and should move into our large intestine within a few hours. When there's poor movement, things can either back up and go from the large intestine into the small intestine, or the food sits there for too long and the bacteria have too long to work on them, which can help grow this bacteria, as well as lead to that excess fermentation. Some conditions that can lead to impaired motility include gastroparesis, so that's a slower emptying from the stomach, scleroderma, which can cause some narrowing in the digestive tract. There's also some things like achlorhydria, hypothyroidism that we know are related to impaired motility of the digestive tract as well. Next, changes in gut anatomy. So this is unlike sort of a functional change with changes in motility. This is an actual sort of change in the anatomy of the gut. So things like diverticula, which are little pockets, surgical procedures that alter the gut anatomy, so sometimes maybe shortening the gut. What it does is create these little pockets that the bacteria then live in and grow and thrive. Also changes in gut anatomy, some of these surgeries and things that go on can lead to slow motility. I'm also going to put in here, and it ties into the next slide a little bit too, is the impact of foodborne illness. Sometimes we are seeing post-foodborne illness or gastrointestinal bug, SIBO. And sometimes this can create changes to the motility as well as potentially the gut anatomy. So sometimes we're seeing post-infectious SIBO as well, which ties into our next slide a little bit in terms of underlying medical conditions. So we have a list of underlying medical conditions that can lead to alteration in gut anatomy or motility. So things like IBS, irritable bowel syndrome, Crohn's disease or IBD, inflammatory bowel disease, celiac disease, which specifically really affects the small intestines, fatty liver, which affects our ability to create and release bile, motility disorders, we mentioned gastroparesis, post-gastrectomy syndrome. So if people have part of their stomach removed or all of their stomach removed, sometimes we can see this afterwards. If you do fall into any of these conditions and you're experiencing SIBO, it's really, really important to address these underlying conditions to make sure that once SIBO is treated, it doesn't just keep coming back. Again, I'll put in here that sometimes we do see this post-infectious SIBO or post-infectious IBS that could be considered an underlying medical condition as well and really needs to be treated. We also know that there are some medications that can predispose somebody to developing SIBO. This includes proton pump inhibitors or PPIs. So this is quite often used for gastroesophageal reflux disease or GERD. It lowers the acidity in the stomach, which can then make our bodies a little bit more prone to bacteria growing. Additionally, it can cause a little bit of slowed digestive functioning, so emptying from the stomach, which, as we mentioned, can also lead to SIBO. Now, if you've been put on a PPI, there's a reason for that. Reflux is painful and it can cause some long-term damage to our esophagus. So again, really treating the cause, the reflux, whether it's with a dietary approach or otherwise, is really important, along with addressing SIBO. Post-antibiotics. So when people are put on antibiotics, quite often it causes alterations in the gut microflora, including wiping out some of our healthy bacteria, which then leaves basically open land for other bacteria to populate. And if this is not necessarily the best bacteria to be there, it can lead to that overgrowth. It's really important when you're put on these medications, there's a reason. But make sure that you speak to your healthcare provider about potential side effects and risks. And sometimes some of these side effects and risks, such as SIBO, can be negated by taking things like probiotics or following some of the other dietary and lifestyle approaches that I'm going to go through in a few minutes. In terms of dietary factors that can lead to SIBO, we do know that diets high in refined carbohydrates and lower fiber does predispose people to SIBO. This can slow down that movement again from the stomach to the small intestines to the large intestines, and allow to that sort of backing up or constipation. And some of that larger intestine bacteria can get into the small intestine. It really acts as when the food is sitting there, kind of like a feast for this bacteria, and they overly ferment it, produce a lot of gas, and it also leads to their growth as well. So in terms of dietary factors, there are some other ones, but the main one that we see contributing to SIBO is a diet high in refined carbohydrates and low in fiber. Let's move on to treatment options. And the ones that I'm going to go through include antibiotics, prokinetics, dietary modification, natural remedies, and we'll talk a little bit about lifestyle as well. So once somebody is diagnosed with SIBO, the first line of defense is usually, or treatment is usually, an antibiotic. There are specific antibiotics for the treatment of SIBO. A really common one is rifaximin. These antibiotics that are typically used for SIBO aren't generally absorbed into the body. So they really just sit in the gastrointestinal tract, and that's where they need to do their work. So that's why they're specific to SIBO. They generally are pretty safe. We don't see high levels, if any, of antibiotic resistance to these specific antibiotics. However, some people do experience some other side effects, and that could be because perhaps they're also killing off some of the healthy bacteria. Some people find after the treatment, they need to follow a little bit of a low fiber approach as they reestablish their gut bacteria. And then quite often, if we're not layering in antibiotics with other treatments and addressing any of those underlying causes, SIBO will reappear. So they're definitely very effective in in reducing SIBO. But if we're not taking that holistic approach and addressing underlying causes and other methods of treatment, quite often SIBO will reappear. The term prokinetics refers to anything that helps to speed up that motility of the gastrointestinal tract. So it helps to move things through our gastrointestinal tract in a faster manner. Quite often, prokinetics are used in gastroparesis. Some common ones include erythromycin, low-dose naltrexone. Often they're used in addition with an antibiotic. Sometimes they'll be used right away with that antibiotic. Sometimes an antibiotic will be tried first, and if we're not seeing that it's helping, then we'll mix the prokinetics with the antibiotics as well. As we'll speak about, there are some herbal prokinetics that some people choose to use too. Okay, dietary modifications. So there's a lot that can go into this slide, but I'll go through some of them. And the main thing that we need to keep in mind is that it needs to be personalized to the person, and that quite often, for many cases of SIBO, we do need to look at more medical intervention, in addition to the dietary modifications. So not just one or the other, but doing them together. Overall, dietary modifications is a pretty powerful tool. Again, we spoke about the prevention being a high soluble fiber diet or a high fiber diet, helping to move things through the gastrointestinal tract. However, when somebody has SIBO, we do really need to be careful with the amount of fiber and the type of fiber that they're consuming. With SIBO, we want to make sure that we're not giving a lot of food for this bacteria that shouldn't be there to ferment. That promotes their growth and it promotes that gas formation. So we don't want to do that. So the two different dietary approaches that we use are low FODMAP diet and the low fermentation diet. So they're very, very similar. And the theme with both of them is to reduce that fermentation, or that the fuel for bacteria to ferment. I'm not going to go into detail into either of these because it really should be overseen by a registered dietitian. And I want to keep in mind that both the low FODMAP diet as well as the low fermentation diet are not something that somebody should be on forever and ever and ever. We do them as a specific treatment, and then we do reintroduction, and we find the right level. And quite often with SIBO, once it's been treated with dietary modification and or supplements and or medications, people can fully liberalize or really increase the FODMAP content or fermentable fiber content of their diet without having major issues. So again, it really should be overseen by a dietitian. And then we have natural remedies. So the term natural is not something that is regulated, but they're typically supplements, including herbals, that are mixed together that are not necessarily medications. So some examples would be herbal antimicrobials. So things like oregano oil have been used, peppermint oil have been used. There's quite a few other ones that we know are natural antimicrobials. So that would be almost the same as like an antibiotic. Herbal prokinetics. So we know that there are some herbs that help to stimulate the movement throughout the digestive tract. So we have some herbal prokinetics that can be effective. Something to point out with natural remedies is that there's no evidence that they are more effective or safer than traditional medications. There could be various reasons that some people would want to look at a natural remedy versus doing, say, an antibiotic and a medical prokinetic, but it really needs to be assessed on an individual basis. And quite often, this sort of complementary approach is taken if the traditional medications were not well tolerated. So they're not usually the first go-to, but if somebody does try the antibiotics and for whatever reason it's not tolerated or doesn't work, then we have these natural approaches that we can take that sometimes people do find less side effects with. Probiotics. So this is an area of contention in the research. And I think the reason for this is because it needs to be individualized. So probiotics in the treatment of SIBO can be very effective and can be useful, and we do have some good research to support that. On the other hand, we do have some research, and we do see in some clients that probiotic supplementation while active SIBO is going on can actually make symptoms a little bit worse. So it's really, really important to take that individualized approach. And probiotics, as you know, if you're listening to any of the other talks, you'll see that's just not one thing. There's so many different probiotics out there, and sometimes take trying different ones, including bacteria and yeast, different formulations to find one that works best for the individual. And sometimes they're just not always tolerated. And then with probiotics, if they're not tolerated while somebody has SIBO, we do know that post-SIBO antibiotic supplementation, especially if there has been antibiotics used, can be helpful in reducing the risk of SIBO in the future. But again, we really need to take that individualized approach and look at things like specific strains and dosage. In terms of lifestyle, we also know that stress management is really, really important. Stress has a huge impact on our digestive health and gut microflora. Things like mindfulness, deep breathing, regular exercise, and adequate sleep really should be the foundation of promoting good gut health as well as treating SIBO. So while we have all of these other things that we can do, we really need to work on that foundation. And that's something that I quite often speak to clients about. Also, in terms of lifestyle, is really avoiding triggers. So we do know for a lot of people, there are environmental triggers, which could be stress, maybe exposure to different things in our environment, as well as perhaps certain foods or dietary approaches. And so it's really, really important that we track what we're eating, environmental triggers, and symptoms, both when we have SIBO as well as throughout the treatment, and even in recovery, to see if SIBO comes back, what did we change? One app that we really like to use with clients is the CDHF My IBS app, which is a free app and allows you to track all of these different things, including environmental triggers and food. And it tracks bowel movements, it tracks symptoms, and it also allows you to track different approaches that you take, whether it's medication, probiotics, dietary modification, so that we can start to see those trends in what's happening in your life and all these different modalities and your symptoms. So in conclusion, SIBO is a recognized digestive disorder that really requires medical diagnosis and treatment. It should not be something that is self-diagnosed. There's various approaches to treatment, and quite often it takes multiple approaches to really treat it. It's really best to work with your doctor and a dietitian if you suspect you have SIBO. Again, this is an area that I work in, so if you have more questions, you're welcome to send me an email, and I can answer them that way. Thanks so much for your time, and enjoy the rest of the summit.